student nurse taking care of you today. Can I have your name and date of birth, please?
Samantha Kuhn, 2/23/98.
Okay. Do you know where you are?
I'm in Bay City, Michigan.
And do you know what year it is?
2025.
Okay. Because you're alert and oriented, I feel comfortable proceeding with this assessment. I'm going to go ahead and do a head-to-toe assessment on you today. I'm going to get a basic function of all of your body systems. Are you okay if I proceed?
Yeah.
Okay. Before I proceed, I'm going to ask you some medical questions. Do you have any allergies?
No.
Do you have any medications that you take, any herbals or supplements?
I take vitamin D during the winter.
Okay. Do you have any medical diagnoses?
Nope.
Okay. Do you have any family history of medical diagnoses?
Yeah, my brother has ulcerative colitis.
Okay. Do you have any previous surgeries or hospital stays?
Nope.
Okay. I'm going to ask you some medical questions that might make you uncomfortable. Please answer them honestly.
Okay.
Do you have any history of smoking, cigarettes, vapes, or marijuana?
No.
Do you drink alcohol?
Yeah.
Okay. And how often are you drinking alcohol?
Once or twice a week.
Okay. And how much alcohol are you drinking in one sitting?
Not more than 2.
More than
Like
2
drinks.
drinks? Okay.
Yeah, wine usually.
Sounds good.
Mm-hmm.
And what does your diet look like?
I eat a lot of protein, like fruits and vegetables. I get a few meals a day.
Okay. Sounds good. And then what does your exercise look like?
Just working light activity throughout the week. I'm active for my job too. I'm a server.
Okay. And how long are you working out when you do those exercises?
Like usually walking like half an hour, 40 minutes.
Okay. Sounds good. Do you have any issues with continence? Wetting the bed while you're sleeping, or when you are coughing or sneezing, urinating?
No.
Okay. And are you in any pain at this moment? Okay. I'm going to get started with some vitals on you. I'm going to get started with the blood pressure first. Do you have a preference on which arm I use?
You can use this one.
Okay. Sorry, my hands are a little chilly.
Sorry.
No, it's okay. Okay, I'm going to palpate the brachial artery. Good. Sure, my stethoscope's on the diaphragm. I'm going to listen with the diaphragm. Okay, 112/70. Sorry. Okay, I'm gonna feel your pulse for a minute. A few minutes. Okay, pulse was 70, respirations was 16. Assess your fingers for clubbing. No signs of clubbing is present. So there's no signs of poor oxygenation. I'm going to go ahead and get a SpO2 on you. Okay, SpO2 is 99%. Temperature. Okay, 98. Let's see your hands one more time. Check for capillary refill. Check your perfusion. Capillary refills within 3 seconds and is symmetrical. Alrighty. And go ahead and feel your radial arteries. Those are both symmetrical. And your brachial arteries are both symmetrical as well. Look at your arms, the skin. Skin is good, color is good, temperature is good. Again, sorry, my hands are very cold. There's some minor scratches. Where are the scratches from?
Cats.
Ah. Cats. Other than that, muscle tone is symmetrical here. Can I have you do this for me? I'm going to do a range of motion assessment. Grab my fingers for me. Thank you. Push against me. Pull towards me. Pull me towards you, sorry. Push my hands out and in. Push my hands up, your knees up. Push your knees in and out. Okay. And your feet. I'm sorry?
Out, feet out.
Feet out, yeah. And then feet in. Okay. Feet up. And feet down, look on the gas. Okay. Can I have you, let me check your ankles for repentance first. Roll your ankles in a circle for me. Thank you. No crepitance in the ankles. Wash my hands. Okay. Do you know how to swim?
Yeah.
Okay, can I have you do a swimming motion with your arms and go forward? And can I have you go backwards? Thank you. No crepitance in the shoulders. I'm going to test your patellar function in both of your, legs. Close your eyes for me. Alrighty. Okay, can you move your head from right to left? Alright, and can you shrug your shoulders up and down? Alrighty. So your range of motion is good. Your patellar function is good. Your spinal accessory, which is cranial nerve 11, is good. And then we're going to test cerebellar function as well. So can I have you put your hands in an OK sign? Okay, can I have you move your fingers like this? And do that as fast as you can. Thank you. And put your hands on your lap. And then flip them over for me. Do that as fast as you can. Alrighty. I'm going to have you look at the, touch my pen light. And then touch your nose. I'm going to move my pen light. Keep doing that for me. Alright. That was good. So your cerebellar function is good as well. I'm going to have you take your hair down for me. Okay. Do you have any issues with itching or dryness or anything with your scalp? No? Okay. I'm checking your scalp for signs of infestation, lesions, anything like that. Okay, and put your hair back up for me. Any pain or tenderness here?
No.
Okay. I'm gonna palpate the occipital lymph nodes, postauricular, preauricular, submandibular, submental, cervical chain. Pull your shoulders for me, or forward for me. Subclavicular, supraclavicular, sorry. And then you put your shoulders back down. And then I'm going to check on the clavicle for tissue turgor. There's no tenting present, so I'm not worried for signs of dehydration. And because the lymph nodes were not unpalpable, I'm not worried for signs of infection or malignancies as well. Okay?
Okay.
Alrighty. I'm going to go ahead and move on to your face. Skin looks good, color looks good. Do you have any issues with anything in your face? No dry or cracking lips?
No.
No? Okay. Your face looks symmetrical otherwise, including your ears, eyes, and nose. I'm going to go ahead and have you make a angry face for me. Okay? And then can you close your eyes and puff your cheeks out? Oh, wonderful. Keep your eyes closed for me one more time. I'm going to touch a spot on your face and with a Q-tip. Can you just tell me where I'm touching?
Your left cheek.
Wonderful. So basically we just checked cranial nerve 7, which is facial nerve. Okay. Can I also have you clench your jaw? Okay, we're feeling the masseter muscle. You can unclench that. That's cranial nerve 5, which is trigeminal. And then I'm going to touch your face again. I'm going to press on your maxillary sinuses. Any pain or tenderness there?
Nope.
Okay, and your frontal sinuses. Any pain or tenderness there?
No.
Okay. Moving on to your eyes. Do you have any issues with your eyes at all? Any pain, blurry vision, itchy eyes, anything like that? Dry eyes?
Nope.
No. Do you see your eye doctor regularly?
Yeah.
When was the last time you went to the eye doctor?
Like a month and a half ago.
Okay. Do you have any contacts or glasses?
Yeah, wear contacts.
Okay. Is your prescription up to date?
Yeah.
Wonderful. Do you have any issues with me shining a light in your eyes?
Nope.
Okay. I'm gonna check your eyes really quick. Can you look down for me? I'm sorry, up for me. Wonderful. And down. Thank you. Sclera is white. Conjunctiva is pink and moist. I'm gonna go ahead and move on with that shining into your eyes with this light. Look straight at me. Wonderful. Pupils are equal, round, and reactive to light. I'm going to have you look at my pen light one more time. And then out my hand. And back at my pen light. And my hand. And my pen light. Wonderful. And they're accommodating well. So now I'm going to have you follow my pen light with just your eyes. Okay? I just had her check that was checking cranial nerve 3, which is ocular motor. Follow my pen light with your eyes. This is the 6 cardinal fields of vision. Wonderful. And that was checking cranial nerve 3, 4, and 6, which is ocular motor, adducens, and trochlear. Okay. I'm going to check your corneal light reflex by shining that same light right at your nose, and then we're going to look at your nose. Okay? Right at your nose. Okay, corneal light reflex is equal. And then, do you have any issues with breathing at all?
Nope.
No? Okay. I'm going to shine a light up your nose. Can you tilt your head back for me? Okay, turbulence are present. Mucosa is moist. No presence of a deviated septum or polyps. Do you have any issues breathing? I think I already said that. I apologize. Okay. Can I have you plug one of your nostrils for me? And then take a breath. And the other side. Thank you. I'm going to go ahead and check cranial nerve 1. So that's olfactory. To do that, I'm going to give you something to smell with your eyes closed. Can you identify that scent for me? Okay. Okay. And smell.
Coffee.
Okay. So cranial nerve 1 is working well. Now we're going to move on to mouth. I'm going to have you open your mouth for me. Taking a peek around. No presence of fillings, cavities, and or broken teeth. Stick your tongue out for me. And say ah. Thank you. Tonsils are present, uvula and soft palate moved up and forward. So cranial nerve 9 and 10, the glossopharyngeal and vagus nerve are working well. Can I have you stick your tongue out for me and move it from side to side? And cranial nerve 12 is working well as well. That's the hypoglossal. Can I have you pull your bottom lip down for me? And mucosa is moist and pink. Okay. Move on to your ears. Do you have any issues with your hearing?
No.
No? Okay. I'm going to palpate your pinna. Any pain or tenderness here?
Nope.
Wonderful. cranial nerve 8 is something that usually deals with your hearing. It's the vestibular cochlear nerve, so it also is responsible for balance. So we'll focus on that at the end as well, but this is part of it. Looking in the ear for visual signs of earwax or blockages, and none of those are present. Okay. Have you tilt your head back for me? Trachea is not deviated. You put your head back down. Okay, now I'm going to feel for the carotid artery on both sides. Wonderful. I'm going to listen for a bruit. Bruit is a whooshing sound that you would hear that's indicative of a blockage or an aneurysm. Okay, and the skin looks good, color looks good on everything on your neck. Temperature looks good. Okay, can I have you turn around for me? Okay. Thank you. Okay, we're gonna do a thyroid assessment. In order to do that, I'm gonna reach around from the back to the front of you, and I'm gonna I'm gonna deviate your trachea and then have you swallow both times on each side, okay?
Okay.
Okay. And swallow for me. All right, and swallow for me. All right, there's no masses on the thyroid at all. I'm gonna move on to your back. Skin looks good, color looks good back here. Untying this gown, if that's okay.
Yeah.
And I'm gonna wash my hands really quick as well, just before I move on. Skin looks good, color looks good back here. There is some presence of some acne and some moles. Is that normal for you?
Yeah.
Okay. Have you ever been diagnosed with scoliosis?
No.
Okay. Looks like the spine is in line, which is good. And then I'm gonna check for AP diameter. So this is 2 to 1, which is good. And then I'm gonna do a chest expansion check. Can you take a deep breath for me? Alrighty, and that was equal on both sides, which is good. Okay, I'm gonna go ahead and continue with my lung assessment. I'm gonna listen to 12 different lung sounds. And when I do that, basically what I'm gonna have you do is take a deep breath with every time I move my stethoscope. If it makes you feel dizzy or lightheaded, we can stop and then we can go back, okay?
Okay.
All right. Have you bring your shoulders back for me really quick for a moment? Listening in a half moon shape. Okay, you're good. You can relax. All right. Take a deep breath. 1, 2. I'm gonna go under your bra. Okay. Lung sounds were clear. I'm gonna go ahead and move on to something called percussion. We're gonna take 2 fingers and tap like this just to listen for resonance in the lungs. If there's not resonance present, there would be dullness, and dullness would be signs of fluid or masses. Okay. Okay. Guess we're all good. Before we move on, I'm going to just quickly look at my paper to make sure I haven't missed anything at this part of the assessment. Okay, you can lay down for me. Thank you. Alright, I'm gonna lift this pillow up for me.
Okay.
Just for a moment. Can you tilt your head to the right? I'm checking for jugular vein distension and to the left. And there's no jugular vein distension present. Put the pillow back underneath your head.
Okay.
Thank you. If there was jugular vein distension present, I would put the head of the bed to 45 degrees. If it was still present, then I'd be worried for signs of fluid overload. Alrighty. I'm gonna go ahead and assess your chest. So I'm gonna have to pull your gown down. Is that okay?
Yeah.
Alright. Thank you. Let me pull your arms up.
Yeah.
Of course. Alright. Skin looks good. Color looks good. Just a little bit of acne. Is that okay? Is that normal for you?
Yeah.
Okay. I'm gonna feel temperature here. Temperature looks good, great as well. I'm gonna listen to the 5 heart sounds and then a full 1 minute of the apical pulse. When I'm feeling for the intercostal spaces, I do have to feel for them a little bit hard. So if I'm pressing a little bit too hard, please let me know. It might cause you some pain. Okay.
Oh, okay.
Okay. Clavicle. Rib 1. Intercostal space 1. Rib 2. Intercostal space 2. This is the aortic valve. Switching over to the bell to listen to murmurs, 4 murmurs, and listening for a lub-dub sound. Okay. Go over to the left side of the chest, the clavicle, and rib 1, intercostal space 1, rib 2. Sorry.
Okay.
Rib 1, intercostal space 1, rib 2, intercostal space 2. Listening with the diaphragm first. This is the pulmonic valve. Wonderful. Okay, intercostal space 2, rib 3, intercostal space 3. This is Herb's point. Okay. I'm gonna count from the top again, okay? Okay. Rib 1, intercostal space 1, rib 2, intercostal space 2, rib 3, intercostal space 3. I'm gonna go underneath.
Okay.
Rib 4, intercostal space 4. Okay, this is the tricuspid valve. Okay. And rib 5, intercostal space, and then we're gonna go over midclavicular. You put this arm down for me really quick. Okay, you put it down for me so I can specify where the clavicle is. Okay, midclavicular is right here. Okay, you're good. Sorry.
Good.
Thank you. Okay, This is the mitral valve and the apical pulse. So I'm gonna listen with the diaphragm for a full minute here as well, because this is the most accurate pulse in the body. Okay, and then switching over to the bell. Alrighty. The apical pulse was 70, so the same as your pulse. Pull this back up for you. Thank you. I'm gonna pull the gown up for you. Did you want me to cover your legs or anything with the blanket?
No, that's okay.
No? Okay, we're just gonna do an abdominal assessment really quick.
Okay.
Alrighty. I'm looking at the abdomen. I'm not noticing any signs of edema or no distension. Skin looks good. Color looks good. Looking for the abdominal aorta in 2 locations. It's going to be in the epigastric region and it is present. And then I'm going to feel for the xiphoid process and for the belly button in the middle. And then I'm going to listen with my bell for bruits, for the cardiac sounds in the abdomen. Xiphoid process, belly button. Alrighty, this is the abdominal aorta. Go to the diagonal to the right renal artery. And back. And then diagonal again to the left renal artery. I'm gonna have to move your pants for a moment, is that okay?
Yeah.
Okay. Going over here. Left iliac artery. And over here. The right iliac artery. Okay. I'm gonna switch over to the diaphragm and I'm gonna listen for bowel sounds in the 4 quadrants. I'm listening for 3 to 5 gargles in each quadrant. Wonderful. Bowel sounds are present. Now I'm going to move on to percussion of the abdomen. It's the same thing we did on the back, except this time we're listening for tympani. Down a little bit lower. Okay. Wonderful. Tympani is present, and now we're going to percuss until we find the border of the liver. When we find the border of the liver, it's going to be dull sounding, okay? It's right here. Okay. Alrighty. I'm going to move on to palpation. It's going to be light palpation and then deep palpation. If it causes you any pain, please let me know. We can stop, okay? Okay, and then deep palpation. And making sure I'm ending in the left lower quadrant. Okay? You feel good?
Yep.
All right, we can pull the gown down for you. I'm gonna move on to femoral pulses. I do have to go inside of your shorts for this, so it might make you uncomfortable. Are you okay if I proceed?
Yeah, I'm okay.
All right, I'm gonna do one leg at a time. Have you move your leg out to the side for me like frog. Thank you.
Keep going.
Okay, I'm gonna go ahead and listen with the bell as well for Brewy. And my hand is here. I'm gonna go over to the other side. My hand is here. And then I'm feeling for symmetry. Okay, those are symmetrical for you. Pull this down. Alrighty, so go ahead, wash my hands really quick, and then I'm gonna assess your legs. Looking at your legs, the color looks good, the skin looks good. You have some minor bruising right here, here and here. Do you know what those are from?
From like moving against the door and stuff.
Oh, okay. I'm gonna take your socks off.
Okay.
It's okay, it's fine. Alrighty. Palpate your legs. Muscle tone is symmetrical. Looking at your feet. There's no signs of cracking or signs of fungus there between your toes. Heels look good. There's no signs of edema in your legs. Temperature is good up here. And then I'm going to feel your pulses, okay? I'm going to feel the popliteal. Okay. And the posterior tibialis. And then the dorsus medius. Alrighty. Look for capillary refill on the toes. Alright, capillary refill is equal, and then there's no signs of core perfusion in your feet. I'm going to go ahead and do something called sharp and dull before we move on. So, I'm going to show you, I have two different feelings to put on your legs. This one is sharp, and then this one is dull. Okay. I'm going to have you close your eyes. This is your thighs, this is your calves, your feet, the top of your feet, and then the bottom of your feet, okay? And then you're going to tell me which leg I'm poking and with which sensation you're feeling, okay?
Okay.
Alright? Go ahead and begin.
Dull left thigh. Dull right foot top. Sharp right thigh. Sharp left top of the foot. Sharp left calf. Dull right calf. Dull left bottom foot.
Okay. All set with that. So that was checking for signs of that sharp and dull sensation. If you didn't feel those things, then I'd be worried for signs of peripheral neuropathy or loss of feelings in the legs. Okay. I'm gonna have you put your socks on and then move over to the end of the edge of the bed, and we'll put your shoes on really quick. Okay. Shoes? Yes. Okay. Thank you. Did you want me to put them on for you? Okay. I'm gonna tie your hair up and down really quick. So remember in the beginning when I said that we're going to test the rest of the vestibular cochlear nerve?
Yep.
Okay. So now what we're going to do is something called the Romberg test. I'm going to have you stand up with your hands behind your side, with your eyes closed. I'm going to put my hands on both sides too, just in case you're going to fall. We're going to check your balance. So if you just keep your eyes closed, we're going to test this for 10 seconds, okay? All right. Thank you. Okay. Good. That was negative. So now what we're going to do is we're going to turn to the side, and you're just going to take 3 steps this way for me. Okay, you can turn around. And then we're going to walk back heel to toe. Wonderful. You can sit back down. Okay. Alrighty. That concludes my assessment. Do you have any questions for me at this point?
No.
Okay. Last thing I have to tell you is that your rating scale would be 23 because of your activity, your mobility, and then your diet and your continence.
Okay, cool.
Alrighty. Thank you.